Hey everyone, welcome back to the show. Today we're going to untangle TRICARE.
TRICARE, yeah.
We'll look at who it covers and how it works.
Yay.
And all our information comes straight from the official TRICARE website.
Straight from the source.
So you know we're giving you the most accurate information possible.
No, and accurate, yes.
And before I forget, we'll also be taking a peek at the TRICARE Fairness for National Guard and Reserve Retirees Act. A mouthful, huh?
Quite a mouthful, but a very interesting piece of legislation.
Yeah, it really is. It was introduced to Congress on May 18th, 2023.
It aims to sort of tweak, adjust some aspects of the TRICARE program.
Yeah.
Especially for those in the retired reserve.
Right.
Senator J.D. Vance from Ohio,
Okay.
he is the sponsor of this bill, and he's joined by Senator Elizabeth Warren from Massachusetts as the co-sponsor.
That's right.
It's pretty noteworthy seeing these two senators from different sides of the aisle coming together on this.
Absolutely. I think it speaks to the importance of this issue, how it kind of transcends party lines.
Definitely.
Okay, so let's get into the heart of TRICARE itself. Think of it as a huge safety net.
It's a big program. Yeah.
Providing health coverage for millions of people connected to the uniformed services.
Millions and millions.
But, as you can imagine, navigating this system can sometimes feel like you're going through a maze blindfolded.
It can be very complicated. There are a lot of rules, a lot of regulations.
Yeah.
It covers a huge range of individuals.
It does.
Active duty, of course.
Right.
National Guard and Reserve retirees and their families, survivors.
Wow.
Even some former spouses. Then you have the Medal of Honor recipients. And even in special cases, members of foreign forces. It's a very diverse group.
That is a lot of people.
It is.
So let's break down this whole eligibility thing a little bit further.
Okay.
Is there like one thing everyone needs to know, regardless of their specific situation?
Well, I think one of the most crucial aspects
Yeah.
is registration in the Defense Enrollment Eligibility Reporting System.
DEERS. DEERS.
Most people just call it DEERS.
DEERS.
DEERS is kind of the key that unlocks the door to these TRICARE benefits.
It's like the must be this tall-to-ride sign at the amusement park.
Exactly, you got it.
No DEERS. No TRICARE. So make sure you're registered and keep that information current. Now let's talk families, specifically children.
Okay.
What about them and TRICARE? What do we need to know?
Well, children are covered generally to age 21. But if they're enrolled full-time in college,
Okay.
and the sponsor is providing more than half of their financial support, they can actually continue being covered up to age 23.
So it's not just being in college.
No, there are very specific requirements to maintain that eligibility past 21.
Right. And here's where it gets a little tricky. Being registered in DEERS and actually being enrolled in a TRICARE plan are two different things.
That's an important distinction.
Yeah. So parents out there listening need to make sure both of those boxes are checked.
Right.
So their college kiddos stay covered. How does a child get registered in DEERS?
The sponsor needs to visit a Uniformed Services ID card office.
Okay.
And they need to bring a few documents.
Yeah, okay.
The child's birth certificate or adoption papers, if applicable.
Gotcha.
If it's a situation where maybe the child's been placed by an official agency,
Right.
then you would need a placement letter from that agency.
Okay.
You don't actually need the child's social security number to register them initially.
Okay, good to know.
But as soon as you have it, make sure to update DEERS.
Yeah, good point. Now let's talk about something that can be a real head-scratcher. Medicare.
Yeah.
What happens when someone's on TRICARE?
Okay.
They reach the age where they're eligible for Medicare.
This is where things can get a little tricky.
Yeah.
Because you're dealing with two different programs that interact in specific ways. Generally, if you're eligible for both TRICARE and Medicare Part A,
Okay.
you actually need to have Part B to keep your TRICARE benefits active.
So there are people out there who probably don't realize they need Part B
I'm sure there are.
to keep their TRICARE.
Right.
Can you maybe give us a scenario of when this might come up?
Sure. Let's say you're a retired service member. You're approaching age 65. You've been happily using TRICARE for your healthcare needs.
Right.
You become eligible for Medicare.
Yeah.
You need to enroll in Part B to make sure that your TRICARE benefits continue without any interruption.
It's about avoiding those gaps in coverage
Precisely.
as you transition into Medicare.
Yeah.
Okay. Now let's focus on a group that I know a lot of our listeners are part of. The retired reserve.
Okay.
Their TRICARE situation is unique.
Yes. Very much so. The rules for retired reserve members actually change,
Oh,
depending on whether they're under or over 60.
interesting.
For those under 60, their options are a little more limited.
Yeah.
They might be able to purchase TRICARE Retired Reserve.
Okay.
But if they don't do that, they're not going to be eligible for any other TRICARE health plan until they hit that 60 mark.
So it's either buy in early or play the waiting game
Basically.
until they turn 60. What happens when they do turn 60?
Once they reach that milestone,
Yeah.
they and their families become eligible for the same TRICARE health benefits
Okay.
as any other retired service member. This opens up a much wider range of options,
Right.
depending on whether they're living in the U.S. or abroad.
It's like they unlock a whole new level
Yes, they do.
of TRICARE benefits. Now let's talk about surviving family members. This is always a tough topic,
Oh.
but it's crucial to understand what coverage is available in these circumstances. So what happens to the TRICARE benefits when a service member passes away?
So TRICARE is designed to continue providing coverage for the surviving spouse
Okay.
until they remarry,
Right.
and for any children until they age out of the program.
Okay, that's good. Even in those tough times.
Yes.
TRICARE is still there. What steps should surviving family members take
Okay.
to make sure their benefits continue uninterrupted?
The most important thing is to make sure that all of their information, particularly their change in status, is updated in DEERS.
Right, DEERS. It all comes back to DEERS.
Always.
They should also reach out to other relevant entities,
Yes.
like the Social Security Administration,
Yes.
their regional TRICARE contractor.
Right.
That sounds like a lot to handle
It can be.
during an already difficult time. We've covered a lot, but we've only scratched the surface of TRICARE. It's a vast program, lots of details.
Oh, yes.
That can change based on your situation. If someone's listening to this, what's the best way for them to figure out what applies to them specifically?
Well, the TRICARE website is an amazing resource.
Okay.
It really is user-friendly. It lays out all the details about eligibility, the different plans, costs. It has just a wealth of information.
And I would add, while you're on the TRICARE website,
Yeah,
locate your regional contractor's information.
definitely a good idea.
They can answer your unique questions and guide you through the process.
Absolutely. They're a valuable resource.
We're going to take a quick break, but before we do that, take a moment to think about what we've discussed. What stood out? What questions do you still have? Jot down your thoughts, and we'll try to address them as we continue this TRICARE journey. And hey, if you're finding this information helpful, why not give us a like? Subscribe to the channel.
Yes.
Sharing this knowledge with more people would be fantastic. We'll be back soon to dive even deeper into the world of TRICARE.
Looking forward to it. It's pretty amazing how TRICARE tries to be that safety net for so many different people,
It really is.
who are connected to the military in some way. We often think about healthcare in a civilian context.
Right.
But TRICARE is a great reminder that those healthcare needs extend far beyond that, especially to those who serve our country
Absolutely.
and their families. It's a massive system with a lot of moving parts, and it really highlights the unique circumstances that military families often face.
Right. Now, before we get too far, let's circle back to that TRICARE Fairness for National Guard and Reserve Retirees Act we mentioned earlier.
Okay.
Still a mouthful.
It is a mouthful.
But it seems like a really important piece of legislation. Can you break down what the main goal of this bill is?
Well, at its core,
Yeah.
the bill is trying to address what some see as a fairness issue within TRICARE.
Okay.
It really zeroes in on retired reserve members who haven't yet reached the age of 60.
Right. Because, as we discussed earlier,
Right.
they have limited options for TRICARE coverage.
Very limited.
So this bill wants to change that
It does.
by allowing them to get those TRICARE benefits earlier. So they're more on par with other retirees.
Exactly. Instead of having to wait till 60 to get those full TRICARE benefits,
Right.
some retired reserve members could access them sooner.
Which could be huge
It could be.
for a lot of people.
Yeah.
What are some of the specific things in this bill that would actually make this happen?
It proposes kind of a phased-in approach to early TRICARE eligibility for these qualified retired reserve members. So it would start by lowering the eligibility age to 55, and then over a few years, it would gradually reduce it
wow.
further until it reaches age 50. This means those individuals and their families would be able to access those comprehensive TRICARE benefits much earlier.
That's a big change. I imagine a lot of people in the retired reserve community
Yes.
are pretty happy about this. But I'm guessing there are some arguments against this bill as well.
Right. Well, there are always different perspectives whenever you have these kinds of proposals.
Of course.
Some of the concerns that I've heard have been raised.
Yeah.
They revolve around the potential cost of expanding TRICARE coverage this way.
Right.
Because obviously to implement the provisions of the bill, it would require more funding. And so some lawmakers might be concerned about the impact that this would have on the federal budget.
Understandably. Healthcare costs are a big concern for everyone.
Definitely.
Including the government.
Yeah.
Have there been any estimates or projections on how much this expansion might cost?
There have been different analyses and projections thrown around.
Right. But like with any legislation that involves healthcare, it's tough to pinpoint an exact figure. Sure. But it's something that the Congressional Budget Office would likely be tasked with analyzing if the bill were to move forward.
So it's this balancing act.
It is.
Of addressing the needs of these beneficiaries, but also being mindful of the financial implications.
Right.
Okay, so we've talked about children, we've talked about spouses. What about other family members? Like, do parents or parents-in-law ever qualify for TRICARE?
That's a really good question.
Yeah.
And one that comes up a lot.
Right.
TRICARE does actually have a way for dependent parents and parents-in-law to receive care in certain situations.
Interesting.
So if the sponsor is an active duty service member serving for more than 30 days or is retired, they can apply for their dependent parents and parents-in-law to receive care at military hospitals and clinics.
Okay, so it's not automatic.
It's not automatic. But it is an option for those who meet that criteria.
Exactly.
So they might not have full TRICARE coverage like a spouse or a child would.
Right.
But there is a pathway for them to access care at those military facilities if they're dependent on that sponsor. What if they need coverage that goes beyond what's offered at those facilities? Or if they don't live near a military hospital or clinic, are there other options for them?
Well, TRICARE isn't the only avenue for healthcare coverage.
Right, of course.
So dependent parents and parents-in-law who don't have other insurance like an employer-sponsored plan or Medicare or Medicaid, they might want to look into the health insurance marketplace, which is a resource where they can compare different health plans, enroll in one that fits their needs and budget.
So it's a good reminder that TRICARE can be a part of the solution.
Yes.
But it doesn't have to be the whole solution.
Right.
Now let's talk about another group that has unique circumstances. Former spouses. What happens to their TRICARE coverage after a divorce?
This is another one where things can get a little complicated. Eligibility for former spouses really depends a lot on what are sometimes called the 20-year rules. So a former spouse might still be able to keep their TRICARE even after the divorce is final. If a few different things are true. So the first is what's often called the 20-20-20 rule.
20-20-20 rule. Got it.
So if the sponsor has at least 20 years of creditable service toward retirement pay, the marriage lasted at least 20 years. And those 20 years of marriage completely overlap with the sponsor's 20 years of creditable service, then generally the former spouse is eligible for TRICARE under their own Social Security number.
So in that case, they essentially become their own sponsor.
That's a good way to put it.
For TRICARE. But what if the marriage didn't quite reach that full 20-year overlap with the sponsor service? Is there any chance of coverage then?
There is. There's another situation known as the 20-20-15 rule.
20-20-15.
So in this case, the sponsor still needs at least 20 years of creditable service.
Got it.
And the marriage also has to have lasted at least 20 years. But only 15 of those years need to overlap with the sponsor's 20 years of creditable service. So in this scenario, whether or not the former spouse is still eligible for TRICARE gets a little more complicated. And depends on when that divorce was finalized.
Sounds like the 20-20-15 rule is a lot trickier.
It can be.
To navigate. So something for former spouses to definitely be aware of. And maybe seek some clarification on. But either way, the sponsor needs to have that 20 years of creditable service.
At least 20 years,
For the former spouse to even be in the running.
Exactly. That's a crucial requirement. And one other important note, if a former spouse remarries, they generally lose their TRICARE eligibility. Unless, of course, they gain it through their new spouse.
Right. Lots of different qualifying life events that can affect TRICARE.
Definitely.
So staying informed and adapting to those changing circumstances is key. Earlier you mentioned that coverage could extend beyond the typical age limits for children with severe disabilities.
Right.
Can you tell me a little bit more about that?
Of course. So TRICARE recognizes that.
Yeah.
Sometimes there are situations where a child needs that extended care and support.
Hmm.
And so children who are determined to have what they call a qualifying severe disability
Okay.
can continue to receive TRICARE coverage beyond those age limits
Oh, wow.
that normally apply to dependents. This helps ensure that their healthcare needs are met
Right.
even as they transition into adulthood.
It makes sense. It's an important aspect of TRICARE, recognizing that those needs don't just disappear
Exactly.
when a child hits a certain age. We've been talking mainly about TRICARE within the United States.
Right.
What about service members and families stationed overseas? Does TRICARE cover them as well?
Yes, it does.
Okay, good.
TRICARE has coverage options for folks
Yeah.
who are either stationed or living overseas.
Mm-hmm.
The specific plans that are available might vary depending on their location and their status,
Sure.
but the goal is to make sure that they still have access to healthcare even while they're serving abroad.
So TRICARE goes global.
It does.
Let's talk a little bit about Senator J.D. Vance. He's the one sponsoring this TRICARE Fairness for National Guard and Reserve Retirees Act.
Yes.
Can you tell us a little bit about his background? What might have led him to support this particular cause?
Sure. Senator Vance actually has a very interesting personal story. He's from Middletown, Ohio, a town that, like many in what we call the Rust Belt, has seen its share of economic challenges.
Right.
His upbringing was not easy.
Yeah.
He faced family instability and financial hardship.
Hmm.
And he often credits his grandmother, Mama, as he called her,
Wow.
for really being that stabilizing force and offering him guidance when he was growing up.
It sounds like his childhood really shaped his perspective on the challenges that working-class families face.
It seems like it.
So how did he go from those humble beginnings to becoming a U.S. Senator?
It's quite a story of resilience and determination.
Yeah.
After high school, he actually enlisted in the United States Marine Corps
Wow.
and served in the Iraq War.
Okay.
And then after his military service, he went on to pursue higher education, earning degrees from Ohio State University
Wow.
and then Yale Law School.
So from the Marines to Yale Law.
That's right.
What a journey.
And I think all of those experiences
Yeah.
really gave him a deep understanding of the challenges that veterans and working families face.
What made him decide to get into politics?
I think his upbringing in Middletown, his military service, and even the insights that he gained from writing his best-selling memoir, Hillbilly Elegy,
Right.
all of that played a role in him wanting to serve his community on a larger scale. He saw firsthand those struggles that working families were going through,
Right.
and he felt this pull to try to advocate for their interests. And that book, Hillbilly Elegy, really resonated with a lot of people.
I can see why.
And it brought attention to some of those challenges that a lot of folks in his home state of Ohio were facing.
It's really inspiring to see how those personal experiences have kind of driven his commitment to public service.
It is.
So given his focus on supporting working-class Americans and his background in the military, it seems fitting that he would champion this TRICARE Fairness for National Guard and Reserve Retirees Act.
Absolutely, because many National Guard and Reserve members come from those working class backgrounds, balancing civilian jobs with their military commitments. So making sure they have access to affordable health care is vital for their well-being and their family's financial security. And this actually aligns perfectly with Senator Vance's broader efforts to strengthen support for veterans and military families in general. You know, he understands the sacrifices they make and believes they deserve quality health care without having to worry about those financial burdens.
And it's worth mentioning that Senator Vance isn't alone in this. His co-sponsor on this bill is Senator Elizabeth Warren.
That's right.
From Massachusetts. She's a very prominent figure known for her progressive views. And it's really heartening to see lawmakers
It is.
from different sides of the aisle coming together on something as important as health care for those who serve our country.
It's a great example of bipartisanship.
Absolutely. And it shows that ensuring quality health care for those in the military is something that goes beyond party lines.
It does.
So in this part of our exploration of TRICARE, we've delved into the specifics of eligibility, examined various plans, and even touched on the legislative landscape surrounding this TRICARE Fairness for National Guard and Reserve Retirees Act.
It's a lot to take in.
It is. Before we move on to our final part, we're going to pause for a moment and reflect on what we've learned so far. What aspects of TRICARE really stood out to you? What surprised you? We'll try to address any lingering questions in our next segment. And we're back for our final look at TRICARE. We've really gone deep, haven't we?
We have. We've explored eligibility requirements. We've looked at the different plans, the complexities, the legislative efforts to improve this system.
But with any big program like this, there are always those little details, those extra things to uncover. So let's hit a couple more points that might be helpful. We were talking earlier about how a stepchild's coverage can be affected if the sponsor and their parent get divorced.
Yes.
What if the sponsor goes ahead and adopts the stepchildren?
That's a great question. It shows how family dynamics can really impact TRICARE eligibility.
It's true.
So in that situation, if the sponsor adopts those stepchildren, those kids are then considered adopted children for TRICARE purposes, which means that they get to keep their coverage, even if the sponsor and their parent later divorce.
Gotcha. So it's about formally establishing that parent-child relationship through adoption.
It is.
Gives those kids a sense of security.
It does.
Knowing that their health care is taken care of.
We've been mentioning DEERS a lot. For folks who aren't familiar with the military world, can you give us a quick rundown on DEERS and why it's so important for TRICARE?
Sure. DEERS stands for Defense Enrollment Eligibility Reporting System. It's essentially a huge database. It's the backbone of the entire TRICARE program.
Okay.
It tracks eligibility, determines benefits. It has information on sponsors, family members, and anyone else who's eligible. Without being registered in DEERS, you can't access those TRICARE benefits.
So DEERS is like the gatekeeper, making sure only the right people are getting through. You got it.
It's another good reminder to keep your DEERS info updated.
Always.
To avoid any headaches. We've been focusing on TRICARE here in the U.S. What about people stationed overseas? When they come back to the U.S., does their TRICARE coverage automatically switch over?
It's important to remember that when you're transitioning back to the U.S., you need to let TRICARE know.
Okay.
Update that DEERS information. Your coverage options might change depending on where you are and your status. So it's always a good idea to contact your regional contractor.
To make sure everything goes smoothly. So it's almost like you need the right adapter.
I like that analogy.
To plug into the TRICARE system.
Yes.
When you're moving between overseas and the U.S. As we wrap up our look at TRICARE, is there anything else you want to add? Any last words of wisdom for people trying to make sense of this whole system?
I think the most important thing to remember about TRICARE is that it's really designed to be that safety net.
It is.
It's there to give people peace of mind, knowing they have access to health care. Those who serve our country and their families, don't be afraid to ask questions. Use the resources that are out there and advocate for your needs. Because knowledge is power, especially when it comes to your health.
Well said. TRICARE is there to support you, but you need to be proactive. Stay informed and really engage with the system to make sure you're getting the most out of it. We hope this exploration of TRICARE has been valuable for you. If you found it helpful, please share it with others who might benefit. And don't forget to like and subscribe to our channel for more deep dives just like this one. Until next time, stay curious and take care of yourselves.